So let's talk about a huge paradox, one that sits right at the heart of global health. It's a tension that anyone working in the African healthcare space knows all too well. And there it is. That's the core problem. You see, on paper, the policies are fantastic, often world-class, totally aligned with the best thinking out there. But on the ground, where people actually need care, that's where the system just breaks down. And the signs of that breakdown are, well, they're everywhere. It looks like this: stacks and stacks of paper files. A person's entire medical history can get lost, or misplaced, or just be impossible to find right when it's needed most. And what does that lead to? Endless waiting. You've seen them, queues that snake out of clinics from sunrise to sunset. That's not just an inconvenience, that's lost time, lost wages, and for a lot of people, lost hope. It's a massive barrier to getting care. And all that friction, all that waiting, it has a real human cost. Delayed care, a diagnosis that comes too late, a prescription that you can't get filled, a referral that just never happens. These aren't small things. These delays can literally be a matter of life and death. When you add it all up, it points to one single thing: fragmented systems. You have different programs that don't talk to each other, donor projects that work in their own little bubbles. The whole thing feels like a maze with no map. And listen, this is not a new problem, not by a long shot. We're talking about a pattern of failure that goes back 40 years. Back in the 80s, big primary care policies failed because the supply chains weren't there. In the 2000s, HIV programs were strong, but they ended up weakening everything else. In the 2010s, universal health coverage was the big goal, but it just stalled on paper. And now we've got a flood of digital apps with nowhere to even plug in. So that brings us to the big question, right? If the policies themselves are sound, why do they always seem to crumble at the very last step? In the village, at the local clinic, in the middle of a crowded township. The answer, it turns out, is in how we've been defining the problem. Okay, let's stop and think about a word we all know: infrastructure. We hear it and we think of roads, power grids, physical things, but there's also organizational infrastructure, the invisible rails that let a whole system run smoothly, the pipes connecting the policy to the people. And that right there, that's the big aha moment. For decades, we've tried to fix the delivery problem by just writing better policies. But that's like trying to run the latest, greatest operating system on a computer from 40 years ago. The problem isn't the software, it's the machine itself. And that's where a totally new approach comes in, one that isn't focused on writing yet another policy, but on finally building the machine that can run them all. This is AfriPharm Health. And let's be clear, this is not just another app. Think of it as the foundational layer, the execution infrastructure that's been missing all these years. It's the roads, the pipes, and the rails for healthcare delivery. So how does it work? Well, it's a unified platform that tackles 4 of the biggest failures head-on. It provides identity, so patients are no longer invisible. It streamlines access to things like prescriptions. It fixes payments, so clinics and pharmacies actually get paid on time. And it provides real-time data, turning stale reports into immediate action. All right, let's get specific. Take that first big challenge: the invisible patient. Think about someone in a rural village with no formal ID, no medical records. To the national health system, that person might as well not exist. So the solution is actually pretty simple, but it's incredibly powerful. A health worker with just a basic smartphone can onboard that person using their location, a geotag. Instantly, that creates a unified digital profile and gives them a portable health identity that follows them anywhere they go for care. Just like that, the invisible becomes visible. Okay, next up, the prescription problem. Where a great policy just dies at the pharmacy counter. A paper script gets lost, it doesn't meet the new guidelines, or it's just impossible to track. Policy fails right there. So what AfriPharm does is digitize the whole thing with smart workflows. The platform has the latest national policies built right in as rules, so any prescription is automatically compliant, and you can trace every single step in real time. This takes policy out of a dusty binder and puts it into practice every single day. And then there's the money. This one is a huge deal. Think about it. Why would a small local pharmacy participate in a big national program if they have to wait 6 months to get paid? The answer is, they won't. Delayed payments are an absolute system killer. But what if you could change that? The platform makes payouts instant, sending them right to a provider's mobile money account. It can use modern things like stablecoin rails to make it fast and cheap. And everything is totally transparent. which builds trust and keeps providers plugged into the network. And finally, let's talk about data. You see, for years, health ministries have been trying to drive forward while only looking in the rearview mirror. They're making huge decisions about medicine stocks or disease outbreaks based on paper reports that are months out of date. So the fix is to give them a live dashboard, a real-time view of what's actually happening on the ground, right now, down to the community level. If a policy isn't working, the data shows it immediately. That creates this incredible feedback loop for making smart adjustments on the fly. When you step back, you see the disruptive truth here. Trying to fix healthcare with just a few policy tweaks, that's like Blockbuster trying to get rid of late fees. It completely misses the point. The real disruption isn't about fixing the old model. It's about replacing the entire delivery system. It's the Netflix move. And that really is the bottom line. This isn't about slapping another application onto a broken system. It's about building the foundational execution layer that finally makes the whole system work the way it was always supposed to. You know, when you fundamentally reframe the problem, when you see it's about infrastructure, not just policy, you can finally start building a solution that actually lasts. The real question for all of us, then, isn't whether we can write good policies. We know we can. It's whether we're finally ready to build the rails to deliver them.